What should you focus on in a patient demographic report when you're looking at a dental practice to buy? The answers here are age and geography. Before we get into too many details though, first let's talk about what the heck is a patient demographic report? It's a fair question. I'm going to give you the basics because the first time I heard that term, I asked the same question. First, what I'm not talking about is a demographic report from an outside service like Dentagraphics or Doctor Demographics. Two services that are fantastic, by the way. Those outside services use census data to provide accurate information on average household size, whether or not people went to college in the area around the practice, things like that. Those services are great. The patient demographic report that I'm talking about is one that you pull directly out of the practice management software. In fact, I can never remember the names of these reports, so I actually pulled them up on my phone. In Dentrix, it's called the Practice Statistics Report. Eaglesoft, it's called the Patient Analysis Report. Open Dental, it's called the Active Patient Report. These services provide accurate information on the active patients in that practice. They'll pull out things like birthdays, zip codes, they'll tell you male, female, they'll give you all kinds of information on the actual patients that come into this practice. So a patient demographic report gives you a lot of information about the potential active patients that you might be seeing as the buyer of a dental practice. So what should you focus on? I like to focus on two things: age and geography. The age of the patients can tell you a lot about the type of procedures you'll be doing, the type of pushback you might get as you transition from seller to buyer, and whether or not you'll be working with patients that you're actually comfortable working with. The types of procedures that you'll do in a healthy 30, 40-year-old person are gonna be very different from what you might be doing in someone who's 50, 60, 70 years old. When I look at a patient demographic report, I like to see a normal distribution curve of old to young. I like to see a relatively few very young patients, a relatively few very old patients, and a big bump in the middle of everyone in between. If this practice tends to be, for example, cosmetically focused, then I would expect to see that practice skew a little bit younger. If this is a heavy crown and bridge type practice, I might see that patient demographic report skew a little bit older. The context here is important, and you want to think through the types of procedures you want to be doing as a buyer and what you're expecting to pay for. Do the age characteristics of this practice match the type of dentistry that you want to do? Are you going to be seeing a lot of families? Are you going to be seeing a lot of single people? Are you going to be seeing people with long patient health histories or shorter ones? Age can tell you a lot about what you might be stepping into as a buyer. Just like age, geography is going to tell you a lot about the people you're working with. Geography typically comes in the form of zip codes on these reports. They'll show how many patients live in each individual zip code. Very simple process to pull up Google, type the zip codes in, look at a zip code map, and start to see what the zip codes are around your practice. As you start to look at those zip codes, the buyers I work with have found a lot of success in actually physically driving around those zip codes to see if the types of homes in that area match the type of patients they think they'll be mostly working with. That's not to say that you want to see a bunch of huge houses and you'll be disappointed if there aren't mansions on every corner. Just because the houses aren't fancy doesn't mean that you still can't make a lot of money doing great work as a dentist in the area. You just want to make sure that the types of homes match the expectations of what you're expecting to step into with the patient base that you're expecting to work with. Geography can tell you a lot about what is important in a non-compete radius you might negotiate with a seller. A non-compete is always recommended even if a seller never intends to pick up a handpiece again. Non-competes typically come as a radius. They're a circle on a map. So draw that circle. You might find a significant number of patients fall outside of 10 miles, outside of 5 miles. You might find that almost every patient is within a 1 mile radius. So when the seller comes to you and asks for a 5 mile non-compete, you might shrug your shoulders and say, no problem. But on the other hand, the seller might come to you and ask for a 5 mile non-compete. You might look and find a significant portion of your patients are outside of 7 miles, 8 miles, outside that 5 mile non-compete radius. You'll talk to your lawyer, you'll talk to someone like me, and negotiate a larger non-compete radius. Look at geography with an eye towards your patient population and to protect yourself as the buyer. So again, when you look at a patient demographic report, you're looking for two things. You're looking for age to make sure that these patients match the characteristics of those you're expecting to work with, and you're looking at geography for the same reason and to protect yourself in a non-compete. If you have questions about a patient demographic report or how you might line this up with an outside demographics report from an outside company, give me a call. We do this all the time, every day. I've got a number of free resources on how to analyze demographics in a practice, both free blog posts. I have some free podcasts with the owners of Dentographics and Doctor Demographics that you're welcome to listen to anytime. You can find those resources at dentalbuyeradvocates.com, as well as schedule time with me to talk about any questions you might have. Thanks and good luck.